Hi everyone, my name is Reid, and today I'll be talking to you about the creation and implementation of safe consumption sites and why they are worth it. So overconsumption of opioids in the United States have been a massive problem over the past decade. As a result of this, overdose death rates in the US have been rising rapidly with over 63,600 overdose deaths in 2016. The age-adjusted rate of drug overdose deaths was 19.8 per 100,000 in 2016, which is actually 21% higher than the rate of 16.3 per 100,000 in 2015. Some municipalities have taken it upon themselves to create and implement safe consumption sites into their cities in order to combat this problem. And in this presentation, I'll be discussing why we should all be in favor of this decision. So there's some barriers to adoption. Given that there are high levels of stigmatizing attitudes towards people who use opioids, not many people support this movement, as only 29% of Americans support legalizing safe consumption sites, and only 39% supported legalizing syringe service programs. Other barriers to adoption include identifying the right locations, uncertainty about the federal response, mistrust arising from racial injustice in drug policy, and financing. What we're doing now is not working. The communities in charge of medical and health policy in the US have made countless attempts to counteract the epidemic through various methods, such as the release of clinical prescribing guidelines, dosing regulations, establishment of prescription drug monitoring programs, pill mill crackdowns, insurance and regulatory changes to broaden access to evidence-based addiction treatment, and others. However, to date, increasing overdose death rates suggest that these varied approaches have not altered the course of this epidemic. So the solution to this? Safe consumption sites. These sites provide a safe space for people to bring pre-obtained drugs and use them under clean conditions with sterile supplies and safe disposal of used drug equipment. These sites are monitored by staff trained and equipped in the use of naloxone to reverse drug overdose. A majority of these sites can also provide related services, including voluntary screening of infectious diseases, peer counseling, wound care, and referral to other social and medical services such as substance use treatment. Observational studies from sites outside of the United States show that sanctioned safe consumption sites improve the health of people who use the sites by reducing overdose mortality, infectious disease risk, and drug use by facilitating access to health and social services. In conclusion, safe consumption sites are the way to go. Thank you so much for listening, and these are my works cited.